my name is Amber Goana, and I would like to welcome you to my Med Talk. This is going to be some of the things I pulled from the CPJE California law exam, and as you can see, it's going to be basically like a little Naplex, and so each video is just going to go over each section that I kind of pulled little things from, and I hope you like it. So for this Med Talk, we're going to be talking about some medications that have an FDA-approved indication for the treatment of tuberculosis. So tuberculosis, some signs and symptoms: chronic cough, sputum production. The cough is not going to be dry, it's going to be kind of wet. Weight loss, fever, night sweats, appetite loss, hemoptysis, which is kind of like blood that's going to be in that productive kind of sputumish cough. So it's going to be a mixture of blood and just lots and lots of mucus, these things. These patients need to be isolated in a negative pressure room. So we have the right therapy, which stands for rifampin, isoniazid, pyrazinamide, and ethambutol. Another name for rifampin is Rifidin. That's usually dosed 10 milligrams per kilogram per day with a max of 600 milligrams a day. Or you can do 10 milligrams per kilogram 2 to 3 times a week. This medication needs to be taken on an empty stomach. You need to avoid taking with protease inhibitors. Known to cause flu-like symptoms. It can also cause thrombocytopenia, liver function tests to be elevated, and also cause red-orange body secretion. Next, there's isoniazid, also known as INH. It's dosed 5 milligrams per kilogram per day with a max of 300 milligrams a day. It can also be dosed 15 milligrams per kilogram 2 to 3 times a week with a max of 900 milligrams per day. This medication is also taken on an empty stomach, just like rifampin. It is known to cause neuropathy, so you need to take it with vitamin B6. It can also cause hemolytic anemia, agranulocytosis, drug-induced lupus, headache. It can cause your pancreas to be a little bit inflamed, cause Stevens-Johnson syndrome, and it can also elevate your liver function test. Pyrazinamide is dosed 20 to 25 milligrams per kilogram per day. A max dose kind of depends on the weight of the patient. It is known to cause an increase in uric acid levels in the blood. It can also cause joint pain, and just like isoniazid and rifampin, it elevates your liver function tests. Ethambutol, another name is myabutol. It's dosed 10 to 20 milligrams per kilogram a day, a max of 1.6 grams a day, or dose 25 to 30 milligrams per kilogram 3 times a week with a max of 2.4 grams a day. Or you can do 50 milligrams per kilogram 2 times a week with a max of 4 grams a day. Patient needs monthly eye exams when they are taking ethambutol. An eye exam is a must. It's known to cause vision damage, color blindness, confusion, hallucinations, and just like all the other ones in the right therapy, elevate your liver function test. So you definitely want your patient to get their blood drawn to make sure before they even start their liver function is not already messed up. If you want them to be on the ethambutol, a regimen with ethambutol, you got to make sure they are doing that eye exam. If you want them to be on isoniazid, you got to make sure they're taking it with pyridoxine, which is vitamin B6, because it causes that neuropathy. There are 2 phases in tuberculosis. There's the latent phase, and then there's the active phase. Latent phase consists of a combo of different things. So you could do isoniazid as monotherapy for 9 months, or you can do rifampin monotherapy for 4 months. Another option is a combination isoniazid and rifampin for 12 weeks. but it is not recommended for HIV positive patients, pregnant patients, or patients less than 2 years old. You don't want to be on that combo isoniazid and rifampicin if you fall in that category. For the active TB, two things that has to happen here. So for the first 2 months, you're going to be on rifampicin, isoniazid, pyrazinamide, and ethambutol, all 4 of those for 2 months. Or, until susceptibility tests have resulted. So you're going to be on at least those 4 regimens for a minimum of 2 months. And then for the remaining 4 months, if your susceptibility results come back, you want to make sure the patient stays on rifampicin and isoniazid, again, determining, that their susceptibility test that those 2 drugs are going to work for them. So that's what you're going to do for the remaining 4 months. So the total duration is at minimum 6 months for a patient with active TB. And believe it or not, that was actually all the FDA-approved tuberculosis treatment options that they listed. So again, my name is Amber Gawana, and I wish you the best of luck in all of your studies.